Hello everyone, my name is Dr. Jacobs. I'm a doctor of physical therapy and I'm an inventor of ASTR specialty. I'm also a cancer survivor and I used to suffer from chronic migraines, headache, pain and fatigue before I invented ASTR specialty. Alright, wow. Tell me what's going on with your hip. What happened?
Yeah, it's just been injured for a very, very long time, and I've sought all sorts of help.
Mm-hmm.
You know?
How long that been going on?
I would say, honestly, the last maybe 6 years.
6 years.
It's only been really aggressive in the last 3 years.
3 years. So you injured 6 years ago. Yeah. How did you injure it?
Yeah, most likely sporting injuries, you know, cumulative over the years. Tennis, basketball, soccer. Yeah, I've played a lot of sports. Yeah.
So a lot of sports.
Yeah.
Okay, so you injured your hip 6 years ago. The last 3 years you've been having a lot of issues with it. Okay. How much you feel pain there, and where do you feel the pain?
Yeah, mostly in the groin here.
In the groin area. Do you feel it in the joint or the muscle or both?
Both.
Okay.
Yeah.
So for the last 6 years, can you tell me what kind of treatment did you had before coming here?
So, yeah, all sorts, like acupuncture.
Acupuncture, okay. Massage, okay.
Physio.
Physical therapy,
okay.
Chiropractor.
Yeah. You name it, I've been through the rounds.
Okay, so you basically did everything in the book.
Yeah.
Okay. So what's difficult for you to do, and how much pain do you feel with what you're doing?
Still,
from 0 to 10.
Yeah, I mean the worst is the adduction. Is it or adduction?
Internal rotation here?
Yeah,
okay,
yeah.
and flexion? Okay, so let's do the motion that's aggravated and tell me from 0 to 10 how much pain do you feel there?
Yeah. So that.
How much from 0 to 10?
Probably about a 5.
Where do you feel it?
Right
in the groin area?
Right in the groin, yeah.
So flexion 5 out of 10, okay? What other motion?
Yep, so that's when I lift it up, and if I just rotate
it,
or any
external rotation inward, okay?
That would just pull me and just want to make me feel
how much for 0 to 10?
It's about a 6 or 7 now.
6 or 7, yeah. Okay, so it's increasing this way. Outward is okay or the same?
Outward's kind of the same at the range, maximum range. It would
kind of pinch tight.
Me. Yeah, it will pull, and yeah, probably about a 7 as well.
Okay,
yeah.
So flexion, internal and external rotation. Yeah. Let's have you stand up because you were mentioning you had issue with the squat, so we'll have you squat down and we'll see how that feel. From 0 to 10?
Probably this is probably my best if I wasn't.
How much do you feel pain with that?
It's very unstable and weak. And yeah, it starts pulling it
from your IT band.
Yeah.
Okay.
Yeah.
So squat, flexion, internal.
Right there, that's my max range, and that would about a 7 to 8. 7 to 8.
Okay.
Oh, and I just want to fall over. From there.
Don't fall here, okay?
Yeah.
Not in the front of the camera, okay? All right. So we'll have you walk back and forth. I want to see your gait.
Okay.
And let me know if you feel any pain. Is your hip usually catching you? We'll go back and forth this way. Yep. So you have been walking like this for the last 6 years or 3 years?
Yeah, the last 3 years. Pretty much the last 3 years.
You're very stiff.
Yes.
Yeah, you see, you're limping.
Yeah.
Wow, okay. So, any pain with that?
There's no pain, thank goodness, but I just feel it's heavy, it's weak.
It's look like you're walking like a robot. Okay, we're gonna work on that.
Yeah.
All right, so we'll have you lie on your head this way. Where are you coming from?
Because Melbourne, Australia, all the way from Melbourne, Australia.
Where is that?
You don't know where Australia is, Doctor? No.
Australia?
Yeah, Australia. Yeah.
You coming from Australia?
All the way from.
Welcome to California. How long is the fly?
16 hours.
Oh my goodness! Welcome. Yeah. I thought like some place in California because we have like weird names of cities. Okay, so you guys have a winter now there?
Yeah, yeah.
Australia, welcome to California. Yeah. Wow. Well, I had a lot of patients from Australia actually came, and the longest distant patient who came here was from Renown Island. If you heard about it, it's very close to Madagascar.
Oh wow!
She actually flew. It took her 24 hours to get here. Yeah. So that was the longest distance patient that I saw.
Yeah. I'm really actually keen to learn this as well, doctor. So yeah.
That's cool.
I saw the package online that
Yeah.
yeah, you purchase the tools and also
Yeah,
the
you
online
can
learning.
you can treat yourself.
Mm-hmm.
That's very easy. I have it for patient, step by step. If you have a family member, because the location here, you probably will need someone to help you.
Yeah.
Just do it.
Yeah.
Definitely, that's a good option. The feedback, actually, we get a lot of like phone calls and email. Patient was like, use it for 1 day or 2 days, and they're like, oh, I feel great. I'm like, yeah, I'm glad you're able to do it. You know, on your own at home. Yeah, so that's a good option for outstate patient. Okay, so if there is no scar tissue, it should feel like nice and smooth like this.
Okay.
When you have a scar tissue,
It should be grinding.
you feel that bump
Yeah.
here?
Oh,
You see that? You see that?
Oh.
That's a scar tissue.
Yeah.
So our muscle should act like a rubber band when it contracts and relaxes, stretch like this. So when you have a scar tissue, it's like you have a knot in a rubber band.
Yeah.
So when your muscle contracts, it does not stretch much. So that's why you have a lot of muscle spasm there. Are you a healthcare provider or?
No, just private. Yeah.
Is that too much?
No.
But
you
you feel that scar tissue here?
I definitely feel I've worked on it before. Even I got like
Get the foam roller and
everything,
hammer and chainsaw. Nothing works. Everything in the hardware store. Yeah. I actually did that when I was inventing those tools. I went actually to the hardware stores and get plastic and rubber and cut and shave because I did not have much money, and I was like, I wasn't sure about design, so I'm trying to get something from not very expensive, you know. But now I just manufacture everything. Is that too much?
No, please.
But you feel.
Yeah, I mean, I've even tried, those scraping tools and...
Graston?
Yeah, Graston.
Sorry about that.
Yeah.
Okay.
But
those metal tools?
Yeah. I really like your tools, the way you've designed it, because it really... It's
ergonomically designed.
Yeah, absolutely.
It's a piece of rod. Piece of rod that's really twisting. So ergonomically, it's not ergonomically designed. The material is terrible. I don't think it's a good material to work on the body. Metal, you could cause trauma very easily with metal compared to plastic. You know, yeah. So you hear all of that, yeah. Okay. So is it okay to work on the front here? Okay. Is that too much?
No.
Yeah, I've never been in Australia. It's beautiful, isn't it?
Yeah.
Yeah. So how long are you staying here in California?
I've been here actually, this is my third and final month, and I'm due to fly back on the 25th.
On the 25th?
Yeah.
So you have time here.
I've been everywhere else, and I thought, man, my last week I better, see Dr. Jacobs, because this is not going away.
Well, that's good you were able to come here.
I know. It worked out really well.
Calls from patients that's why I have the online courses.
Yeah.
Because we get a lot of calls and emails like patient cannot fly here.
Yeah.
And I just want to be able to help more people, and the only way to do it is just have those online courses for patients to do it themselves. It's very simple as long as you follow the steps, you know what I mean?
Yeah.
Because it's not only the tools, we go over the ergonomics, nutrition, inflammation protocol, we go over behavior modification. A lot of, sorry, I guess I'm lotioning your pants, is that okay?
Yeah, no, that's fine, honestly, yeah.
Okay, you feel that grinding here?
Ah, yeah. It's
okay, all of that scar tissue.
Yeah.
And here, you feel that? Sorry. Is that painful? No. It's okay.
You're speaking exactly what I know. I mean.
But you don't feel pain, do you?
No, I feel it, but it's not bad. It's not, you know.
If you feel pressure, that's okay.
Yeah.
If you feel pain, you know the inflammation we talked about?
Yes.
Do you want to rub open wound?
No, of course not.
Because it's going to inflame more.
Exactly right.
So just imagine that's internally. If you feel pain with what I'm doing, we're stimulating more inflammation.
Right.
We don't want to do that. So it's okay to feel pressure, but it's not okay to feel pain.
I see.
So make sure you let me know. So I will actually modify my pressure here to.
Right.
So how did you fail, or you just repetitive strain injury from sports?
This started 11 years ago, I believe, in the gym when I did the deadlift, and it all went wrong, and so I had to get laminectomy.
Avoid deadlift, period, especially with weight.
Yeah.
Before you leave, we're gonna go over, or even when you get the online course, I have the exercise, so just follow it in the online course. If you don't have a chance to come back here, but I will not do other courses than the exercise in the course, because I have the entire wellness workout when after the treatment. It's all function training. There's no machines. So I show that in the course, but I will avoid. And personally, you can easily injure yourself with dead weight left.
You know, that's when I was young and hungry, you know, so now it's kind of like, forget it, health and body. So
I want you actually, is it okay, I will have you lie on your stomach, head on the other side. So I'm gonna work on your hamstring and your glutes. Okay. Bend your knees. So most of your scar tissue, so you said you've been having back pain issues.
Yeah, absolutely.
What happened here? It's looked like a kind of scar.
That's me going into hard with a stick.
What?
That's me going into hard with a stick.
Oh my goodness, self-treatment. Actually, that's a self-torture, okay? Don't do that at home. So you get those trigger points, stick with the knot to torture yourself with?
Yes.
I hate those. It's so painful. You know what I mean?
I know, but when you're in chronic pain and you just want something to release it, you know.
When you're in chronic pain, you want to have more pain. What happened here? There's this big scar here.
Yeah, I had the laminectomy 2008.
Laminectomy?
Yeah.
Is that okay to work here?
Yeah.
How are you doing there? Are you fine?
Everything has been amazing since seeing Dr.
Okay.
The doctor.
Yep. Okay. So I'm gonna work on here. Man, what else did you use?
I've used everything, believe me.
So you use the trigger point.
Yep.
What's called those nods with. Wow. It was very hard plastic.
Yep.
Man, you really hurt yourself.
Yes.
Yeah. So if you start to cause bruises or damage, you're causing inflammation. Which means if your body gonna heal, gonna go down to the proliferation stage. Which means you're gonna build more scar tissue from the new inflammation. So it's kind of contradict what you're trying to do.
Right.
So think about this way. You have a cut. Okay? And do you want it to heal and get closer, or you say, okay, this cut is not healing, let's cut it more so it will heal faster. That doesn't make any sense.
Right.
You know? Because how you guarantee the new cut gonna be healing and stimulate the healing for the old cut?
Mm-hmm.
Does not make any sense.
Yeah.
You know? And unfortunately, that's what a lot of courses, they use it for those metal tools.
Yeah.
They believe, oh, let's stimulate the inflammation. I'm like, you are gambling because you don't know if the body gonna cause more, build more scar tissue than the old one.
Mm.
It's really hard to predict. So why you gamble
Mm-hmm.
with the stimulating the inflammation? We actually want to decrease the inflammation, not increasing it.
Mm.
You know?
Actual
Release?
tools and
Yeah.
It's
Hmm.
nothing. I mean, it helped, you know, but just never was able.
Well, based on the study, it actually provides short-term pain reduction.
Uh-huh.
So, but, you know, do you want to spend money on something short-term?
No.
No.
Well, we have. That's why. You know.
Yeah.
That's why I'm here now.
Do you feel the scar tissue here in your hamstring?
Absolutely.
You feel that?
Yeah.
And visually, I can see that. I don't know if
Yeah.
you can see it in the video, but
yeah.
it's like grinding here.
It's crazy. It's been there for a while.
Mhm. Oh, well, I made a mess here. It's your fault, okay? Get it on the floor and everywhere. Is that too much here? And here in your...
Oh yeah.
You feel that?
Oh, that's.
Make sure it's not painful, okay?
Yeah, that's definitely painful.
Sorry.
Yeah,
That's
that's
your,
okay.
it's a big knot here.
Yeah.
How's that?
Super painful.
What
but-
happened here? You get a scar tissue here.
Yeah, that was a swimming pool incident.
Man, you beat up your body. Did you spring?
No, I was
battle
just
or-
sitting in. I was just sitting in the spa pool, and you know, they had the old tile. One of it was kind of
So you sled?
yeah,
Oh,
and
boy.
just it just cut me right open.
Oh.
I was sitting in there just relaxing, and then next thing you see is all red blood
Oh my.
floating everywhere, and they
goodness.
freaked out too, you know.
But he did not fracture anything. did
No,
he?
no.
Just a laceration from
Yes.
the skin. Okay.
Yeah.
Okay. All right. So wow, I really made a mess here. Okay. How does it feel?
Yeah, normal. Yeah, when you go deeper, yeah.
Is it painful or just pressure?
No, just pressure.
Okay. Pressure is okay. Pain is not okay. Okay.
Mhm.
You should feel pressure. That's part of the treatment.
Mhm.
Pressure is okay. Pain is not. Would you want to stimulate the pain? Or I call it the sign of inflammation is pain actually.
Mhm.
So you stimulate the pain, you're probably stimulating inflammation.
Right.
So it does not really make a lot of sense to do that. Okay, let's do flexion. And tell me how that feel. How's that?
Wow, yeah.
Any pain or it's gone?
Yeah, almost gone. I mean, it's just a dull kind of pull, but that restrictive pain is not there.
So you feel pulling, not pain. Is that
Yeah,
is that correct?
correct.
Okay. Yeah, you're gonna continue feeling tightness because it take a few sessions to really clear up the scar tissue.
Sure.
Every time when you clear it, your muscle can stretch, the rubber band can stretch further. Actually, tightness is not my concern. That's just gonna take a few treatments. My concern is the pain, the muscle spasm that you experience from the tightness.
Yeah.
So let's do internal and external rotation, twisting in and out. How's that?
That's pretty good.
You were making faces before, yeah?
Yeah.
Okay.
No, that's
Outside. How's that? That's going further, yeah?
Wow, yeah.
Mm-hmm. It's, how's that?
Yeah, I mean the pain is gone for sure. Oh, at the end range.
Where do you feel it?
Right here, but
In the back?
Right here.
Oh, let's
Yeah.
drink more water.
Yeah.
I'm serious. If you're dehydrated,
Yeah.
you're probably gonna be, because when I break the scar tissue, it I release toxics and waste product with the process. It's like massage. So you want to flush it out so you don't get like soreness from those toxic. And try it again and see. How's that? You feel it or it's gone?
Magic.
This is not a holy water, by the way. Okay. Okay. So let's.
Wow.
I want you to stand up and let's do squats. Because you were saying you were imbalanced. How's that? And did you notice something?
Yeah, I'm not having to fear of grabbing onto the table. Wow.
You were grabbing on the table before.
Wow.
Wow. Do a couple of them. So suddenly your strength came back.
Yeah.
That's not sudden. That's when you have a scar tissue, it weakens your muscle. Your muscle is not stretching. When we break the scar tissue, your muscle contracts properly.
Wow, so simple yet so effective. That's amazing.
So let's walk. I want to see how you walk now. So suck your stomach nice and tall and just walk back and forth. How'd that feel?
Yeah, I like.
We definitely gonna work on your gait to correct it.
Yeah.
What I notice is it just
kind of
we need to
swings out and.
No, here's the thing. It's a bad habit.
Yeah.
It's a bad habit. You still like have those like bad gait pattern because you compensating. So part of the treatment will teach you how to walk properly.
Okay.
You should land on your heel.
Yeah.
Heel to walk. Heel to walk like this. You land in here. Yep, pick up. Yeah. We need to work on your right side too.
Yeah.
You're tight everywhere.
Definitely, yeah.
But any pain or it's okay?
Amazing.
Okay.
Amazing.
So you had chiropractor, physical therapy, occupational therapy, massage. You get the
Everything
Graston tools. You had the trigger point nod, myofascial release. So can you tell any difference between everything and just ASTR treatment and the field treatment?
It's so incredible. You know, I've been watching your clips online and experiencing it firsthand. It's incredible. Just so simple, but so effective. Yeah. Now I truly understand. Okay. Yeah. This is wow. So incredible. Thank you very much, Dr. Jacobs.
Thank you, and welcome to California from Australia. I hope you use that as a vacation too.
Oh, for sure. Thank
you very much. Awesome. Thank you. Feel free to subscribe to my channel to get helpful tips on how to relieve pain and watch real treatment videos. There are over 45 studies that support ASTR treatment model. If you are a patient and would like to schedule an appointment or treat yourself at home, check the link below. If you are a healthcare provider and would like to receive ASTR training and buy ASTR instrument, check the link below. See you soon.